This video continuation of non-tuberculous mycobacterium. This one group 3 already group 1 group 2 completed. Group 3, that is non-photochromogens. They do not form pigment even on exposure to light. The colonies produced by them resemble those of tuberculosis. The medically important species in group 3, they include Mycobacterium Avm, Mycobacterium intracellular, Mycobacterium xenophi, and the skin pathogen Mycobacterium ulcerans. What are the four species? Comes under group 3, Mycobacterium Avm, Mycobacterium intracellular, Mycobacterium xenophi, and skin pathogen Mycobacterium ulcerans. So first discuss first species, Mycobacterium Avm. This causes natural tuberculosis infection in birds and lymphoadenopathy in pigs. Mainly affected birds and pigs. This Mycobacterium Avm is one of the most common opportunistic human pathogen. It is thermophile, capable of grow at 45 degrees Celsius. So second species name is called as Mycobacterium intracellular. It is also known as Pattibacilli because it first isolated Patty Hospital, USA. This Mycobacterium, first two species, Mycobacterium Avm and Mycobacterium intracellular, together they form complex. That complex name is called as Mycobacterium Avm complex, which causes lymphoadenopathy, pulmonary lesion, disseminated disease, particularly in AIDS patient. So it causes lymphoadenopathy, pulmonary lesion in AIDS patient. Third species, Mycobacterium xenophi, occasionally cause chronic lung disease in human. This one similar to Mycobacterium avm. This is also thermophile, grow at 45 degrees Celsius. Next category, group 4, rapid growers. This is the heterogeneous group of Mycobacteria. They produce rapid growth. That is, colonies appear within 7 days of incubation period at 37 to or 25 degrees Celsius. So group 4 rapid growers, heterogeneous group of Mycobacteria, they produce rapid growth. Colonies appears within 7 days of incubation at 37 or 25 degrees Celsius. Within the group, photochromogens, scotochromogens, and non-chromogenic species occur. All these three groups comes under the fourth group. Photochromogen, scotochromogen, and non-chromogenic species will occur. That medically important species in group 4, Mycobacterium fortuitum, Mycobacterium fortuitum, and Mycobacterium silone. Mycobacterium silone, Mycobacterium fortuitum, and silone. Both are medically important species, comes under group 4. These two species cause chronic abscess in human following the injection of vaccine. Next, coming to skin pathogen, there are two main species, Mycobacterium ulcerans and Mycobacterium marinum. This Mycobacterium ulcerans belong to group 3 of Runian's classification. This marinum comes under the group 1 Runian's classification. These two species are causing skin infection. They cause chronic ulcer and granulomatous lesion on skin. First see about that Mycobacterium ulcerans, which causes disease is called Bruley ulcer. The ulcer are usually seen in legs, arms, and follow infection through minor injuries. That clinical features of Mycobacterium ulcerans first started indurated nodules, which then break down and forming intulated ulcer. They slowly extended under the skin. Diagnosis of Mycobacterium ulcerans. They do not produce any pigment. According to group 3 of Runyan's classification, which are non-photochromogens, thus mere presence of large clump of bacilli which are acid fast and alcohol fast. Then these Mycobacterium ulcerans which produce a toxin which causes inflammation and necrosis when injected into skin of guinea pig. Okay, these Mycobacterium ulcerans, they only Mycobacterium species producing toxin. Okay, these only producing toxin. Next species Mycobacterium marinum, which causing disease is called swimming pool granuloma or fish tank granuloma. It is natural pathogens of cold-blooded animals, which causes tuberculosis in TB in fish and amphibian. Mycobacterium marinum can also occur saprophytes in fresh and salt water. So human infection through contaminated swimming pools or fish tank. That's why it called swimming pool granuloma or fish tank granuloma. Next, clinical features. First, the lesion start as papule. Lesions start as papule, which break down to form indolent ulcer. This one most commonly occur in prominence like elbows, knees, ankle, nose, fingers and toes. These ulcers are self-limiting and undergo spontaneous healing. Here the bacilli are scanty in smear from the ulcer. Finally, treatment. Various drugs used for treatment purpose, rifampicin, ethambutol, isoniazid, and various combination drugs like rifabutin, clofazimine, then quinolones. These are the drugs used for treatment of non-tuberculous mycobacterium disease.